Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein, and today, a big show, 9 businesses, including USA Insulation. But right now, Dr. Ian Bulow from Revive Upper Cervical Chiropractic is back on the show. Good to see you again, Doc.
Thanks so much.
I always have somebody come up and ask about what you were talking about when you were on the show.
Yeah.
So if somebody's watching today and they haven't seen you,
Sure.
where do we start?
You know, it's interesting. We always talk about our slogan is actually healing starts at the top. So let's start there. When you look at the body, one thing that we know is that the brain is the boss. Absolutely, end all be all. You can't survive or function at your fullest unless the brain is functioning the way it should. And at the top of the neck, at the top of your spine, you have a couple little small bones that protect that area. And so through injuries and accidents, people develop problems in the neck that lead to problems all throughout their body. And so when we say upper cervical chiropractic, what we mean is a specialized form of chiropractic that starts by realigning the top of the neck so that the brain can really start to do some nice things.
So if somebody, as they're going through life, maybe has some issue with some part of their body, it could be traced to an accident or an injury that they had when they were a kid.
Yeah, the one thing we stress to parents of our patients or the adults that are patients themselves is that through life, the neck is one of the weak links, right? It doesn't have all the supportive muscles and ribs and discs that the rest of the spine have. So make no mistake, the people that have chronic health issues, so people that are on multiple medications that don't with really no end in sight, people that have just pain all the time, or they have to modify their lifestyle, like I can't eat this food because it'll make this happen, or I can't, you know, if it rains outside, I have a migraine. Usually those people, if they look back, they probably had a car accident, they had a concussion when they were a child, they have a very stressful job where they're stooped over all the time. It's not a coincidence that the people that have the most chronic health issues usually had a little bit of a spinal injury through their life at some point.
And in not all cases, but some cases, this can be corrected and changed?
Absolutely. Absolutely. When we get in those chronic issues of people that are constantly in a state of disease, typically do the best. Because again, the brain has that ability. Just this year, we had a child no more than 5 or 6 years old that has had 12 sets of tubes put in the ears. Over the course of his life, he's had a dozen ear surgeries and about 50 ear infections. Now, he hasn't had an ear infection since we started working with him in May. That's pretty awesome. We have another guy who had Arnold-Chiari malformation. It's this brain disorder that makes it hard to speak, hard to balance out. He's coming all the way from Donegal. We're in Cranberry Township. He drives an hour across the turnpike. He's doing so well that we now see the post office person for that town. We see a restaurant owner from that town, people in his life that saw him dramatically improve. So it's not just a theory that maybe it could help. No, we see this all the time.
And it's not just one specific thing, it's multiple things that are triggered through neck and back injuries.
Sure. Most common, you're going to see things like headaches, numbness in the hands when you wake in the morning, maybe sinus infections and acid reflux. But what I tell people is that if it's a problem that you can set a watch to or a calendar to, I mean, a symptom every once in a while, that's life, stuff happens. But if it happens repeatedly, internally, there's something keeping your body from getting well, and it's our job to figure out what that is. And if it's not us, we'll refer you to someone who can, but we want to get to the root cause of it rather than just kind of micromanage the symptoms for the rest of our life.
Right now, everybody listening and everybody watching is going, wait a minute, I had sinus, my sinuses are running right now, I had acid reflux last night, and my hand was a little numb when I woke up this morning. So
it's not a coincidence.
So all of these things could possibly be addressed.
It all comes down to the nerves. So the nerves control the headaches, the nerves control what you feel, they control how anxious you are. When you're mentally stressed out, you give yourself heartburn.
Yeah.
So if you're physically stressed out, you get the same symptoms. So it's not a coincidence. It's just our job to step back, look at the body as a whole, and try and figure out what's going on under the surface and get that corrected once and for all. I mean, it's really a pretty simple process.
You have a couple of events coming out. You're going to be out answering questions.
Yeah, absolutely. So if someone's interested in coming in for a consultation, we have them on a limited basis. We do them complimentary, so they can just call our office. If they want to see us out in the community, we're going to be actually at McGinnis Sisters next week doing an interactive talk on whiplash injuries and concussions. And then we have a couple other in-office events. So they can call the office, they can go to our website and see what's coming up. And we'd be happy to interact with them.
And this is something that you can trace back. Everybody had, an accident when they were a child, or whether, it was a car accident or falling on some steps or in the backyard. it could be traced to that event later in life that is leading to
Absolutely.
your headaches and sinus issues.
It's no different than hitting a pothole in your car and the tires wearing down over time.
Yep.
Whether it's a cesarean birth, which is actually pretty traumatic on the baby's neck, or whether it's a fall or a car accident or a sporting injury or a concussion, these things add up. Life accumulates.
Yep.
You know, it accumulates good things and it accumulates bad. And these injuries add up, and then we wake up one day, we have our Saturday through Sunday pill container, and we wonder what happened. That's just the way it works.
Thanks, Dr. Bulow. If you'd like to know more about Revive Upper Cervical Chiropractic, you can call Dr. Bulow. Set it up today at 724-772-7060 or log on to revivepittsburgh.com. USA Insulation is going to keep our homes warm this winter. That's on the way when Showcase Pittsburgh continues.